So I'm here today to talk about posterior ankle arthroscopy. Now, ankle arthroscopy is a technique by which we use a telescope to look inside your ankle joint. We do this because sometimes there are things that need to be fixed up in the joint, like there might be a loose body, there might be an area of damage to the cartilage, there may be a torn tendon. Now, we generally speaking, this is a model of an ankle which I brought along to show you. This is the front of the ankle. This is the tibia, which is the shin bone. That's the fibula, which is the other side of the ankle. If there are problems in the front of the ankle, then we pop a telescope in the front of the ankle. The telescope is like a pen. It's about the size of a ballpoint pen and about as long. And we basically make a little nick in the skin, push aside the nerves, which are just in front of that area, and then we bluntly enter the ankle. Now, most of the pathology in the ankle is in the front, but there are definitely people, and I see quite a few of these people, who have problems in the back of the ankle. Now, in the back of the ankle, and you can see that the back of the ankle is still described by the shin bone, the fibula on the outside, and the talus posteriorly. You can see that there's a little piece of bone here, which is called the os trigonum. Now, the os trigonum is a common thing. It's about 8 or 12% of people, and it's a piece of bone that just didn't quite heal back to that when you were very young. Now, that can sometimes be detached in a violent ankle injury. And if it is, we pop a telescope in the back of the ankle, remove the os trigonum. There's a condition called posterior impingement, where when you bring your foot down into that position, this area crushes into the back of the ankle. That's what's called posterior impingement. And sometimes removal of this area and or stabilization of this area will deal with that problem, once again through the ankle. There's a big tendon that comes through here called FHL, and it can sometimes also be injured. Now, the other thing to think about is the fibula here, and behind the fibula there are two tendons, one of which goes down into here, and one of which goes underneath the foot across into the big toe. Those tendons can be injured with ankle injuries in general terms, and once again we can look at those through the telescope and if necessary repair them.